My name is Marina Nafula. I'm the founder of Warriors of Hope organization, and I'm a breast cancer patient with metastases of the lung and on active treatment currently. I have faced several challenges with my treatment, among them lack of information pertaining SHA. First of all, there is no clarity with how one can acquire the emergency fund, at what point and where can one start. Another thing is system failure sometimes, because I went for chemotherapy, my second chemotherapy, and the system in the hospital was indicating that my cover has expired, yet I have paid until 2027, which was a shock, and it was traumatizing for me. My pressure shoot, and it was bad. I had to make calls at SHA, and nobody was picking my calls, so their 147 number. I had to use somebody to assist to get the a screenshot of my coverage, showing that I was valid until 2027, but the hospital was still insisting that in their system it was not updated. So this was a burden to me as a patient, because matter system does not concern the patient. So long as the facility is accredited with SHA, they both communicate. Why should the patient be subjected to this back and forth? So that was the challenge that I faced. And another one, a fellow patient also, her M-Pesa account has been receiving deductions from SHA, and she did not subscribe to Lipa Mdogo Mdogo, which for us as patients is a threat to our data, because one has to subscribe in order for the monies to be deducted. We are not sure how this came to happen, and there's no clarity about this. Another issue is on use of spouse coverage, because upon registration of SHA, you are supposed to submit details of your dependents, including the spouse. But it's not clear, because for some patients it works, for others you cannot use your spouse's cover. I think there should be a review on that, so that the cover should not be pegged on household, rather to be pegged on an individual, because for patients for somebody like me, cancer already is a risk factor in my family, and all my family members need to go for screening. They need to access that service. But now, since it's been pegged on a household, it's only the two of us who can assess, which is a risk.